Hi, Sarah.
Hi,
How are you doing?
I'm good. How are you?
Young and beautiful lady. What have you done cosmetically before on the face?
I've had Juvederm in my cheeks.
Juvederm.
hmm
Was it Juvederm, like Juvederm Ultra XC or Juvederm Ultra Plus XC?
Yes, one of those. It had the XE in it. I'm not sure which.
It's very funny. People come and ask, hey, make sure it's XC, as if like they're buying a car.
Yeah,
The
I don't
XC is the
know.
least important part of the situation.
Okay.
XC means extra comfort, means it has some lidocaine in it. So,
Okay, it definitely had lidocaine in it.
okay, which is pretty. I mean, that's again the most insignificant one. But you're
Okay.
sure that it was not Voluma? It was not
Yes, I'm
Juvederm?
sure it was not Voluma.
Okay, perfect. When was it? Without telling me the name of any physician.
It was about 2 years ago.
About 2 years ago. How did you like the results?
I liked it initially. It was really natural looking. To be honest with you, I kind of wish it was a little bit more. It was almost too natural looking. And I feel like it faded in about 4 months, if that. It was
How many
gone.
syringes was it to begin with?
It was one.
One
So I
syringe
had
is.
point 0.5 in each.
Okay, I'll take it. Okay, just without, I have no idea why we are talking, but you didn't disclose to me. This is pure surprise for me. But I wouldn't use Juvederm on you, just
No?
so you know.
Okay.
Yeah. So having that said, anything else have you done cosmetically before?
No.
Okay. All I know about you is you drove about an hour to be here, and I'm
Yeah.
so thankful for that. So, Sarah, what can I do for you today?
I would like the same treatment with using something else, something that will last longer, and I'd like a more visible result. So,
So, basically, we're talking about cheek
cheek.
enhancement.
I have smile lines, and it's because like I feel like my lower mouth or jaw or whatever is a little bit heavier. I have like chubby cheeks, so I feel like it kind of is hanging. And so when I had the Juvederm, it just kind of lifted it up, and it took a lot less, I guess, pressure from my smile lines or whatever. You know what I mean? Like that was my issue. I went in because I have smile lines, and they're just too prominent. I feel like they're creasing my makeup, and it's bothering me. So.
Yeah, God, this is a very long conversation now. So listen, I don't know where to start. Okay, so if you've been my sister and you wanted to do this, I would possibly suggest you, come on, you're too young, you're too beautiful, you're very good. Take it easy, don't do it. So that's one very honest statement. At the same time, there are some red lines that if you do want me to do something that is going to make you looking fake or less beautiful, that's passing my red line. I will refuse you. So at the same time, you're not passing the red line. So what you are asking with some caveat is going to actually improve your beauty. And that's a very big deal because you are very beautiful. It's very hard to make a very beautiful person a bit more beautiful. The cheeks, for sure, we are gonna make it. The problem with Juvederm is when you do it, it's gonna act as if there is some fat there. So we wanna use something that's gonna resonance as bone. It's gonna show as if you are more bony. It's gonna give you a little bit more curvature on the face. So for sure we are gonna do that, and it's gonna make your face more beautiful, a bit look thinner, a bit sexier, a bit more prominent cheekbones for sure. But at the same time, thinking that you do that and that's gonna make the laugh lines to go away, yeah, this is one of those, in many cases, it's not going to happen. It's one of those myths that have 2% a grain of truth in it, and then people are overselling it. So that's one part of things, and of course, I do not see any nasolabial. I do see sharp lines of nasolabial. Possibly, I would expect that you tell me that when you do makeup, some of the makeup sticks in the line. Does that happen? Yeah. So I do see that in you, and for sure, 100% in that part, that the cheek doesn't do anything for that.
Okay.
If that is really bothersome, then we need to inject very superficially some sort of filler on the nasolabial to get the sharp line out. It's not about having a nasolabial or laugh line. This is a sharp line.
Okay.
And I'm not necessarily big on nasolabial, which I do it when it's too deep. But for God's sake, my daughter is 2 years old, and she has laugh line. And she's very beautiful to me. Right? So having that said, sometimes that's part of the natural beauty of the face. Having all these things said, assuming that we are going to do the cheeks, what kind of questions you might have for me?
I just was curious as to what you're going to use.
Possibly in your case with the dense tissue, as young as you are, and as the fact that I want to make it more bony and I'm going to make it lift, I would go with radius.
Okay.
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 What else? And at the same time, I do not like necessarily patients to get involved in the decision of, hey, which product are we going to use? The result is going to be more of your focus.
Yeah.
But sure, go ahead, continue. What else?
I don't really have any other
Huh,
questions.
you are a very easygoing patient.
Yeah.
Do you want to know about downtime?
Sure.
That's easy. None.
All right.
Okay. Do you want to know about bruising?
I don't really bruise too much.
You broke my heart. So because if you said I bruise a lot, I would say none again. So no bruising.
Okay.
Do you want to know about pain?
Sure.
Not much.
No.
I will actually block your circulation.
Okay.
Do you want to know about if there is any guarantee on the results?
Sure.
Do we have such a thing? Yeah. So yes, the answer
Okay.
is yes.
I
There will be a guarantee, and
Okay.
there will be 100% promise that you're going to love the results.
Okay, cool.
So in some areas I can promise 100%. Cheeks for sure, lips for sure, nose for sure. So these are the easy stuff.
Right.
Sure, absolutely. Okay. What else?
Let's see. Can I wear my makeup?
If you don't do any Botox on you, you can do full makeup
Perfect.
before leaving your office.
Yay. Okay.
What else?
Let me see. I don't even know.
All right, so let's do this. I'm going to turn off the camera. We're going to talk
Okay.
now about cheeks off camera a little bit.
Okay.
And if you decide only to do the cheeks, then that would be it. And we are going to put you on the table and we're going to do it. You're going to love it. If we ended up adding the nasolabial, then I might put you on camera again. Or we might actually do it and then afterward we are going to bring that up. Sounds good?
Yep.
Thank you so much.
Thank you.
Yeah. Hello again, Sarah.
Hi.
So, how was the pain?
There was no pain.
How fast was the procedure?
Maybe like 7 minutes.
7 minutes it is. Okay, perfect. So, and then you're going to do some makeup later on, and the result is going to be way better and better in the next couple of days. Week 3 is going to be the best results anyways. So go ahead and grab the mirror and share with us if you see any changes. Okay.
Oh, wow.
Do you
wow,
see
I love
anything?
it. Yeah.
Perfect.
Yeah,
So it's
so
prominent.
cute.
It's bone prominent, so it's not gonna move with your smile, which is really good. It's pulled up a little bit to the tail, if I may.
Yeah.
And then with some makeup and the next couple of days, that the swelling goes away and it's gonna be part of your own tissue. The result is gonna be interestingly way better.
I like
So
it.
you've been the best patient. You don't have any bruising. Thank you so much, Sarah.
Thank
and
you.
Drive safely.
Thank
Bye.
you. Bye.